Today medicine is lisinopril. It is an ACE inhibitor. ACE stands for angiotensin converting enzyme. Lisinopril is used to treat high blood pressure in adults and children who are at least 6 years old by relaxing blood vessels. Its FDA-labeled indication include hypertension, congestive heart failure and myocardial infarction, and may also be used for diabetic nephropathy, erythrocytosis, kidney disease, and migraine. Common brands available in market are Prinival, Zestril, and Krellis. Step back to mechanism of action. Lisinopril is a long-acting ACE inhibitor. It prevents the conversion of angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor. Decreased angiotensin 2 leads to decreased vasopressor activity and finally decreased aldosterone secretion. It is available in the forms of oral tablet and oral solution. In hypertension, start with 10 mg orally once a day and 20 to 40 mg as maintenance and max dose is 80 mg per day. However, higher doses do not provide additional benefit. In acute myocardial infarction, 5 mg orally once daily for 2 days, then 10 mg orally once for at least 6 weeks. In adjunct heart failure, start with 5 mg orally in combination with diuretic. And for migraine prophylaxis, just use 10 to 25 mg orally daily. It has fetal risk under pregnancy category. This drug may cause nausea, vomiting, dizziness, headache, or angioedema. Instruct patient to report signs or symptoms of hypotension or a persistent cough. ADME of lisinopril. Tmax will achieve within 7 hours in adult. Bioavailability is about 25% and there's no effective food. It will not bind to protein. And there is no special metabolism. During renal excretion, it remains 100% unchanged. Common cardiovascular adverse effects are chest pain, mild or severe hypotension. Neurologic adverse effects are dizziness and headache. And in respiratory system, cough may bother the patient. Rare adverse effect, like Stevens-Johnson syndrome, hyperkalemia and renal impairment is reported. Lisinopril showed major drug interactions with valsartan, telmisartan, losartan, potassium, and alteplase. Blood pressure response should be monitored at monthly intervals. Monitor closely in patients with stage 2 hypertension and BP of 16 per 100 or greater. Patients are at risk of hypotension during the first 2 weeks of treatment or when dosage of lisinopril or diuretic increase. Serum potassium should be monitored periodically, especially in patients with risk factors of hyperkalemia, including those with renal insufficiency, diabetes mellitus, or use of potassium-sparing diuretics.